She had to have an emergency cesarean section for this. And you know, in most of these private facilities, between 6 and 7 p.m., it's visiting time for the husband after the family have gone off. So the nurse was doing a 6 p.m. blood pressure check on this lady. And the husband playfully said to the nurse, "Please check my blood pressure." And she checked, so she puts the machine on and it starts flashing. He tells it in a very funny way. He says the machine started flashing in red. The nurse looked really worried.
That every headline is screaming of that blood pressure is actually soaring worldwide. Are we witnessing a true epidemic?
And there's a 1 to 2 in relation between weight and blood pressure. If you gain 10 kg, your blood pressure can go up by about 20 millimeters of mercury. The opposite is true. That urbanization, that change in lifestyle. Your genetics don't change, but the lifestyle impacts how your genetics then predispose you to certain diseases.
So we are correct to interpret hypertension as a lifestyle disease. Can we say it's a lifestyle disease? Welcome viewers once again to the MEDTALK show brought to you by Pharmaceuticals. So today we have in the studio Dr. Pfumojena. He is a specialist physician. We're here to unpack again the subject of hypertension. We want to look at hypertension and everyday risks and the management of hypertension by lifestyle. Welcome to the show, Dr. Pfumojena.
Thanks, Inoka. It's a pleasure to be here.
I'll give you the time to introduce yourself to our viewers.
So I'm Pfumojena. I'm a specialist physician by training. I work at Salim Gabe Central Hospital here in Harare. Also do a bit of private practice. I'm also involved in medical education and a bit of medical administration in the country.
Thank you for taking the time to be with us this morning. So, Doc, let's cut through the jargon. What exactly is high blood pressure or hypertension, and why should every single person listening to us right now be caring about this?
Okay, so basically, when we talk about hypertension or high blood pressure, it's exactly that. It's when your blood pressure is persistently above a certain limit. Currently, the well-accepted number for the top figure, which you call your systolic, is 140. For the bottom number, which you call your diastolic, is 90. And the basic way to think about it is your circulatory system is like a collection of pipes that are circulating blood around your body. If the pressure is too high in those pipes, you can then get damaged either to the pipes themselves or to the organs to which the pipes are passing through. So the higher the pressure, the higher the risk of acute, but more importantly, long-term damage to those pipes.
We also notice when we're reading around, when we are monitoring on the internet, social media, that every headline is screaming of that blood pressure is actually soaring worldwide. Are we witnessing a true epidemic, or maybe especially here in Zimbabwe, it's just a hype?
No, that's very correct. And in fact, I'm always reminded of you know, if you ever go around sometimes on Saturday mornings, you see these events where there are people taking blood pressures. It'll be a fun day, or people will be doing jogs or running, and a lot of people actually are going around without knowing that they've got hypertension. In fact, it's estimated anything between 50 and 60% of the people with hypertension actually are going around and they don't know that they have it. And truly, if you look at in our practices and in terms of specialist practices, but even as we go around day to day, there's a very high burden of hypertension in the country and globally as well. Yeah, and it's a factor of lifestyles. It's a factor to do with the way the diets have changed. People have become more sedentary. There's less. People are not spending as much time active and on their feet. The kind of food we eat, the kind of fast food we eat, high salt diets, but also weight gain. You know, weight is an important predictor of hypertension. If you gain weight, your blood pressure will go up, together with obviously all the other lifestyle metabolic diseases that you then become predisposed to.
And one might also then point to knowledge as well, which is what we're also just trying to address with the MEDTALK, perhaps to bring our viewers to the call to know about hypertension.
Absolutely. You know, they actually recommend that every adult above there, some say 25, some say 30, should actually get at least once a year, get a blood pressure check. Because that's the only way you'll ever know that you've got. So even if you feel absolutely fine, get a blood pressure check. Get it done in the pharmacy. Go get it done at your GP, at your local clinic. But worse still, if you have a family history of it. So if either of your parents or siblings have hypertension, you're at much higher risk of that. So you do need to get your blood pressure checked. For women, if you've had elevated blood pressure in one of your pregnancies, then you also should be monitored, because there's a large number of women who have pregnancy-related hypertension do develop hypertension. Either it stays elevated after delivery, or they develop hypertension later on in life.
Let's split this to say between men and women. Who is perhaps at a higher risk? Who is on the hot seat here? Is it men? Is it women?
So that's
when it comes to hypertension.
That's a good question, and it's difficult to say. I would say everybody's at risk, right? By and large, because they are lifestyle-related things. So, but we tend to find more women with it. But I think it's to do with health-seeking behavior. I'll tell you a funny story, actually, of a patient who I now see today. So this gentleman, his wife had pregnancy-induced hypertension. So she'd actually delivered, and she had to have an emergency cesarean section for this. And, you know, in most of these private facilities, between 6 and 7 p.m., it's visiting time for the husbands after the family have gone off. So the nurse was doing a 6 p.m. blood pressure check on this lady. And the husband playfully said to the nurse, "Please check my blood pressure." And she checked, so she puts the machine on, and it starts flashing. He tells it in a very funny way. He says the machine started flashing in red. The nurse looked really worried. She went out, bought a second nurse with a different machine. They checked it again, same thing. And then they bought that manual blood pressure machine. And the poor nurses were so worried, because this guy's blood pressure was, I think, 220 over 140, which is really, really high. So both men and women have significant risks, but your lifestyle as well. Alcohol is a significant risk factor, and we know that generally the rates of alcohol use are higher with men versus women. Like I said, obesity is a risk factor. Sedentary lifestyle is a risk factor. So if you spend most of your time, like we do, sitting in an office and not walking or on your feet, your risks are there. So I would say I wouldn't put gender as an independent risk factor in itself, but more to do with lifestyle for that gender. Yeah,
which also aptly describes then hypertension as the silent killer that is connotated to be.
It absolutely is. You know, we see this regularly in our hospitals, where someone comes in, and the reason they've come in is actually the complication of the hypertension. They didn't know that they had it, but they've come in now, and the first time they present to the hospital is when they have a stroke, they've had a heart attack, they've developed leg swelling, and they've got kidney problems now as a complication. And that just speaks to the fact that you often don't feel anything when your blood pressure is high. When it's very high, you would maybe sometimes have chest pain, you might have a headache, you might find breathing difficulties, but that's when it's really high. But for a lot of people with mildly or moderately elevated blood pressure, they're walking around, living their best lives, and often only present to a medical facility for the first time when they've developed a complication of the disease.
Growing up, we would hear of hypertension as something for the elderly. Should the young also be concerned?
Absolutely. And the age cutoffs have been coming down. You know, we used to think hypertension didn't happen to young people, but we now see a significant number of both men and women in their early to mid-30s being diagnosed with hypertension. So people are getting it younger and younger. But I would say it comes back again to saying, if we look at the lifestyle of a 30-year-old 100 years ago, when we were more of an agrarian society, and you would spend most of your time farming, etc., and you would be active during the day, and you were eating fresh food coming out of your garden or out of your field. Now you are probably more sedentary, you spend most of your time sitting, and you're getting food coming out of a box or out of a packet that's been processed. So already that lifestyle shift, the urbanization that's happened in Zimbabwe, already predicts that what we call lifestyle diseases, metabolic diseases, are going to happen to more people and younger people, because that urbanization, that change in lifestyle, your genetics don't change, but the lifestyle impacts how your genetics then predispose you to certain diseases.
So we are correct to interpret hypertension as a lifestyle disease? Can we say it's a lifestyle disease?
It's a bit of both, Enoch. So it's definitely there's definitely a lifestyle component to it. There's definitely genetics, and genetics are a powerful predictor of it. Like I mentioned earlier on, if you've got a parent who's got it, or a sibling who's got the disease, you're more likely, and your lifetime risk is much higher. But also just age in itself, as people get older, the risk of hypertension does increase. And they say if you live long enough, you'll end up with high blood pressure if you live long enough, right? But the lifestyle is really, really critical. And how the lifestyle impacts this is that the lifestyle can make the difference between having borderline and elevated high blood pressure or requiring certain treatment. Some people may not necessarily need drug treatment if they fix their lifestyle. Sometimes you may not need 2 or 3 drugs. You may just need 1 because you've done significant lifestyle interventions. So it's a bit of both, but it's not purely lifestyle. It's really a combination of lifestyle with genetics and other things around how you live your life.
So let's now zero in on this scope.
Yeah.
Let's take someone who is feeling perfectly fine on their normal everyday. They are feeling perfectly fine. What are some of the everyday habits, if we were to put it like that, that one could be, engaged in, and these are quietly cranking up, the pressure and maybe their blood pressure without them knowing? What are some of those lifestyle, everyday habits that we tend to then perhaps be living with, which we don't know, but yet they're actually cranking up the risk for hypertension?
And that's a good question, and really speaks to what I mentioned earlier. But the first thing I'd mention is really just being sedentary.
Sedentary.
Just not being active already cranks up your blood pressure. There's good evidence that 145 to 180 minutes of exercise and mild to moderate to significant intensity exercise. So that's a brisk walk, a jog, a swim, Zumba, whatever. That doing that regularly, 2 or 3 hours a week of exercise can bring your blood pressure down by at least 10 millimeters of mercury. The opposite is also true. If you spend most of your time sitting, your blood pressure is going to go up. So you got to be active. Your diet, right? If what you're eating every day, if you're having bacon, eggs, and sausage every day for breakfast, and you're having chicken and chips every day for lunch with lots of salt, that lifestyle aspect is huge. And I mean, I'll zero in on the salt, because high salt intake in itself, above and beyond whatever else you're eating, high sodium intake is an independent risk factor as well for elevated blood pressure. So it's inherent in the way we do things. I always laugh at myself and our friends. You go out for a meal, and the first thing people do before they actually eat the food is add salt, right? Before they actually eat the food, right? So I always tell people, cut your salt intake down. Think about it. There's hidden salt in many things we eat, but when you now think of how much salt you're going to add to your food. Half a teaspoon a day is the max you should be adding to anything. So think about that's 3 pinches. It's a pinch at breakfast, a pinch at lunch, a pinch at dinner. Then, of course, we mentioned weight gain in itself is so you need to watch your weight. If you're picking up weight, exercise, lose weight, and there's a 1 to 2 relationship between weight and blood pressure. If you gain 10 kgs, your blood pressure can go up by about 20 millimeters of mercury. The opposite is true. If you're 10 kgs overweight and you drop that weight, your blood pressure can go down by almost 20 millimeters of mercury, which once again is the difference between you needing pharmacotherapy and medicine versus
lifestyle management.
So those simple basic things make a big difference. Alcohol as well, I mentioned earlier. I'll say this, there are very rarely benefits to drinking, but definitely in terms of hypertension, alcohol in excess is a risk factor. And in excess, I'm talking about anything more than 2 units in a day. So anything more than 2 standard drinks in a day is going to push your blood pressure up. So even though we sometimes say we're going to have a drink to de-stress, you might de-stress, but actually end up pushing your blood pressure up.
There you have it, viewers, unpacking necessary lifestyle modifications that will actually help us to manage hypertension better. So, Doc, if lifestyle changes are so powerful, what are then, maybe from your experience, the first 3 things that you would usually recommend to a patient with high blood pressure, and those changes that people can realistically start? Even our viewers, as soon as they hear this, what are some of this conversation?
I think the first thing I would say is get a comfortable pair of sneakers and get active, right? So get a comfortable pair, a good pair of running shorts and a t-shirt. Get out there and take a walk every morning. Do a 30-minute walk every morning. That's something small but has long-term benefit. Keep the salt off the table. That's the second thing. So dish your food, but keep the salt off the table, and then cut down the drinks. I think those 3 things will keep it to 2 standard drinks a day or less. Those 3 small interventions will make a big difference. Likewise, it'll actually help to lose weight as well, which if you're overweight, if you do 30 minutes of walking a day, you cut your alcohol intake, it's going to make a difference.
And would the same apply, say, for someone who has not yet been diagnosed, but also maybe wants to then proactively start to adjust their lifestyle?
Absolutely. I think these are good interventions for everyone, because we're not just looking at hypertension and saying, the number, but we're looking at what's called your overall cardiovascular risk. So that's your risk of over 10 years of having a heart attack, having a stroke, right? And those are life-altering events. So those interventions I spoke about won't just make a difference in terms of bringing your blood pressure down, but they reduce your overall cardiovascular risk. And if you're thinking of healthy aging, it's about your cardiovascular disease is still one of the biggest contributors to mortality and morbidity. So if you can reduce your overall cardiovascular risk, you'll live longer and live healthier.
Thank you for unpacking that. The other thing also around hypertension, Dr. Pfumojena, are the myths that usually do the rounds around. You know, some people, myself included, would think that if I feel fine, then I don't need to worry. What are some of the common misconceptions that we might need to clear up, even in a conversation like this, around hypertension?
Okay, so I think the first thing I would say is the fact that you feel fine means there's nothing to worry about. With a lot of diseases, lack of symptoms doesn't mean you're disease free. So if there are things that you can check, get it checked, right? The same way that for your vehicle you do routine services, because you know if you don't, eventually it breaks down and it'll cause problems. Get routine health checks and blood pressure. That's why if you walk into a clinic, usually the first thing that the nurse does is they check your blood pressure.
Check your blood pressure, right? Yes.
And then there's a misconception that only people who are stressed or who have problems have high blood pressure. There's a misconception that it's a disease of stress. And actually it's not. It's a disease of genetics, a disease of lifestyle. So stress in itself may contribute in a certain way, but the fact that you're not stressed doesn't mean your blood pressure is going to be good. And then, of course, I know in Zimbabwe we always believe everything. We're very spiritual, so sometimes people believe it's witchcraft, and it's not, right? So the same way that if you do require therapy, get the treatment. We have really good, affordable treatments that work, that will keep you healthy if your blood pressure is high, above and beyond the lifestyle. So that aspect of people thinking that, no, it's witchcraft, I will pray my way or go to a prophet and this will be removed from me. I would say that that's a misconception that we need to deal with.
Well, thank you for that, Doc. I'm actually appreciating also just to say it doesn't add then to say if you feel fine, you have no need to get checked. Actually, viewers out there, let's prioritize getting checked. Let's prioritize routine, having routine BP checks. You did mention earlier, Dr. Pfumojena, about pregnancy. And I'm sure this will be also interesting. What is it that expectant moms or pregnant moms also need to know about blood pressure spikes and perhaps the risks that then are there for the mother and the baby that they are carrying?
That's a really good question. So what we've been speaking about mostly in this part is this thing called essential hypertension, that usually is blood pressure that's elevated, but there are no other sort of things that have triggered it. But there's a specific etiology of hypertension that's called pregnancy-induced hypertension. Okay. And this typically affects women, usually beyond 20 weeks of their pregnancy, and their blood pressure spikes up. It's associated with other complications, which can include, they can have seizures, it can cause liver abnormalities, it can cause kidney abnormalities as well. So this is a potentially life-threatening form of hypertension that happens quite acutely. So for women, we always say the first thing with women these days, we encourage what's called preconception planning. So unlike the old days where people, the first time they'd go to a clinic or to a doctor is when they're already pregnant. And usually they would go sometime in their in the second trimester. We actually recommend that if you're a woman and you're planning on having a baby, you and your partner should actually go and see a doctor. Make sure that if there's anything underlying, it's been optimized, it's been treated. Make sure that your vaccines and things are up to date. Make sure that you've been screened for STDs, HIV, and everything. You've had a blood pressure check, and then once you've conceived, you get regular follow-ups during that pregnancy, and including regular blood pressure checks, because that is something that's significant. It's something that may not be preventable because it's related more to the blood pressure, but it's something that, if treated, women can at least have a successful pregnancy and deliver a healthy child. But without treatment or without proper monitoring, you can lose both the child and the mother.
So it makes it a very risky
condition. Absolutely.
There you have it, viewers. And maybe, Doctor, as we are getting to wrap up this session, with the hypertension rates rising worldwide, beyond personal choices that one can make, what do you think communities, what do you think workplaces, maybe even the government, what are those things that we can do as communities, as workplaces, as governments to help people live healthier and to prevent high blood pressure?
So I think as communities, let's be active communities. That's the first start. Let's encourage each other to be active, get up, walk, exercise, stay on your feet, right? Let's not encourage sedentary lifestyles. And that means within our communities, let's have walk clubs, run clubs, cycling clubs, swim clubs, dance clubs that make us active in our communities, right? Yes. And I think that's a good intervention. And even in workplaces, right? I found it's really great. I know, for example, in the banking sector, often a lot of the banks have sports teams, they have football teams, and Wednesdays and weekends they play sport as a company. That's really great.
Wellness initiatives.
Yeah, wellness initiatives that actually keep people active. But even in the workplace, I noticed you guys have a nice canteen out there for staff. I hope the food that you're cooking for your staff here doesn't have too much salt and too much fat, and is full of greens and veggie, more greens and fruit and veg. Because a good intake of fruit and veg, will keep your blood pressure good as well. Fresh fruit, fresh veg, what they call the DASH diet, it's good for you as well. And then as governments, the interventions should be the same way. There should be good screening mechanisms where people at risk and people with the disease can be picked up in the clinics, so make sure that all of our clinics can check people's blood pressures. In the same vein, the government, the messaging, I recall 20 years ago when the HIV rates are skyrocketing here in Zimbabwe, you couldn't drive down any road without seeing a billboard about, be safe, use a condom, etc. And if you turned on your TV, turned on your radio, there were always public service announcements. And I think we should have those sort of initiatives where on the television, on radio, like this sort of podcast that we're doing, where we're raising awareness in the communities of the diseases there, what the risk factors are, what you can do yourself to reduce the likelihood of you developing the disease or developing complications. And, create little jingles, ask these lovely musicians to create little jingles for that.
Again, promise you that the MEDTALK will continue. So we'll also continue to give information out there. Even in the canteen, we'll advocate that we remove salt from the
take the salt off the table.
We'll take the salt off the table. Yeah. So if you could leave our viewers and our listeners with one message about preventing or managing hypertension, what would it be?
I think the message is hypertension is real. Hypertension exists. It's extremely common in our country, and it potentially can kill you. So it's something that you should get more. If you should get a blood pressure check. If you're at risk or already with it, you should implement your lifestyle changes. If your healthcare provider recommends treatment above and beyond the lifestyle, you should take it and be adherent to your medication. And if you can make those interventions for yourself, you can live a long and healthy life, even despite having elevated blood pressure.
Thank you, Dr. Pfumojena. This leaves me to thank you for such an insightful discussion. Viewers out there, we have heard it. Hypertension may be called the silent killer, but it doesn't have to be. If the choices that we make every day, those small and consistent changes that we need to make, they really, make a difference. They can add up to a lifestyle that can transform even those of us who are diagnosed with hypertension. Let's take control. Let's give our hearts, let's give our vessels, even our future, the care that they deserve. So the MEDTALK series continues. Remember to follow COSFAM on our social media handles. We are on Facebook. Follow COSFAM on Facebook, on LinkedIn, on YouTube. Like and share even the content that we are sharing on our handles. Until next time, is the MEDTALK.